In the past 2 weeks alone, more than 770 individuals have been hospitalized following accidents involving scooters, mopeds, and motorcycles. The National Center for Traumatology reports receiving at least 20 such cases per day, with 2 to 5 of them requiring hospitalization for severe injuries. One recent case involved a child who had long asked his parents to buy him a scooter. Although they refused, he borrowed a friend's scooter and was injured in an accident. Doctors explain that scooter, moped, and motorcycle accidents commonly result in skull and facial fractures, limb fractures, and injuries to the neck and spine.
My son wanted to try riding his friend's scooter. He often asked us to buy him one, but we always refused because we knew it was dangerous. Since there are no dedicated roads for scooters, we were firm in our refusal. His friend, an 8th grader, had a scooter purchased by his parents. My son tried it, but it was too powerful, and he lost control, hitting a car. Now he has a cheekbone injury below his eye and has been admitted to the trauma hospital. I would like to warn other parents not to buy such dangerous items for their children.
These are not just minor sprains. We are seeing double neck injuries, brain injuries, and fractures that often lead to permanent disability. There are children with severe brain trauma, patients with fractures of the first and second cervical vertebrae, and others who fall from motorcycles and lose 60 to 70% of their working capacity. Such injuries result in irreversible consequences. In the first half of 2025, more than 1,000 accidents and injuries related to electric bicycles, scooters, and mopeds were recorded. The majority of cases involved individuals aged 15 to 19. In addition to riders falling or colliding with cars, there have been many incidents where pedestrians were struck, sometimes by riders who fled the scene. In one recent case, an elderly man was severely injured after being hit by a scooter and is currently hospitalized at the National Center for Traumatology, with the perpetrator still unidentified.
Hepatitis B, C, and D viruses can cause cirrhosis and liver cancer. These viruses are transmitted through blood and sexual contact. To reduce the risk of infection, individuals should maintain good hygiene, avoid contaminated needles and blood products, and refrain from casual sexual contact. Regular blood testing at hospitals is also essential. Those not diagnosed with hepatitis B should be vaccinated immediately to establish immunity. Preventing hepatitis B also prevents hepatitis D, as the latter only occurs in combination with the B virus. However, there is currently no vaccine or preventive medicine for hepatitis C, making strict precautionary measures necessary. The combined presence of hepatitis B and D is especially dangerous. If hepatitis C is detected, there is no need for panic. Although no vaccine exists, effective treatment is available. Physicians monitor viral load and prescribe appropriate medication when required. 97 to 98% of hepatitis C virus infections are transmitted through blood. Mongolia has the world's highest incidence of liver cancer and ranks among the countries with the highest rates of hepatitis B, C, and D infections. Therefore, prevention, regular examinations, and early detection are of utmost importance. Medical professionals emphasize the need to follow infection prevention protocols, ensure timely vaccination against hepatitis B, and detect hepatitis C at an early stage, the primary cause of liver cancer, for appropriate treatment.
A significant number of wild animals inhabit the BOGD mountain sanctuary. However, as the mountain borders densely populated settlement areas, it has become less suitable for wildlife. Wild dogs often attack animals, while fences and other human structures pose constant threats to their survival. Despite these challenges, the private sector has been providing safe conditions for wildlife in BOGD Mountain and quietly protecting them from human interference and noise. Among the most beautiful species in the sanctuary is the deer. Yet in recent years, the rapid expansion of settlements around the mountain has narrowed the deer's migration corridors, restricting reproduction and limiting genetic exchange. To address this, a deer breeding center has been established within the BOGD Mountain Special Protected Area. Deer are brought in from other provinces and SUMs, raised from a young age, and later released back into the wild in cooperation with the private sector. This initiative is aimed at preventing inbreeding among the hundreds of deer living in BOGD Mountain and ensuring their ecological protection. Experts emphasize the importance of keeping wild animals away from humans and avoiding domestication. Deer that grow accustomed to receiving food from humans lose their natural survival skills. Furthermore, during the rutting season, male deer that approach humans can cause accidents and pose risks. Our goal is to increase the deer population in Bogd Mountain. Each year, depending on the birth rate, between 5 and 10 deer are released into the mountain. At present, pregnant deer are brought from the Kustai Range, while male deer are selected and bred from the wild population of Bogd Mountain. Wild deer also have the natural tendency to come and mate on their own. Through these efforts, continuous work is being carried out to increase the deer population, ensure genetic diversity, and safeguard the ecosystem of Bogd Mountain.